morning we are with Dr. Lynnette A with the Menninger Clinic to talk about why this month really means so much. First of all, good morning to you, Doctor.
Good morning. Thank you so much for having me.
So unfortunately, I know you lost your father to suicide as well years ago. Tell us more about the age you were and how this really shaped your story here today.
Sure. So my father was a Vietnam veteran, and like so many veterans then, and unfortunately still now, really struggled with ineffective treatments, struggled without finding answers, for what was going on and how to feel better, and ultimately died by suicide when I was 3. I honestly really don't have much memory of him at all, but very much grew up aware just of the effects of stress and trauma, not only on the person who experiences that themselves, but the wildly significant ripple effects through the family, friends, community. And that lived experience, I think, has really just shaped my entire career and why I have so much motivation and passion to do the work. That I know the impact, I know the urgency, and I know the results.
It's incredible for you to turn your own family's pain into help for other people. And I would feel like your patients at Menninger are really tied to that they can relate to you even more, knowing that you've suffered this and you're not just reading them and trying to help them out of a book, right? This is your own life experience.
Yeah, I think across all of the time that I've been a clinician, a researcher involved in policy and advocacy, that does come through. I think there are so many incredible mental health practitioners, and many of us come to this work with some sort of connection or tie. And I do think having that lived experience does just give you a different perspective. It gives you a different lens. When you have that authentic, real understanding, I think the patients know that, the families know that you understand the fear, you understand the worry, you understand the helplessness, the hopelessness, and you really do understand the implications and the urgency.
What are the signs that people should be looking out for loved ones if they potentially have a loved one who could be considering doing something like this?
I think that is a really challenging and complicated question, and one of the reasons that we still have so much problem limiting the effects of folks who are struggling with suicidality, because there really is not any checklist of items or behaviors that are always a red flag or are never a red flag, that it really is so variable. I think one of the things that I would say is any significant changes in behavior or interaction, whether that is that someone becomes more isolated, down, negative, depressed, withdrawn, or on the other side, that someone actually seems much calmer, happier, less anxious, because we know that both of those can be a sign. I think really the most critical thing that we can do is just kind of keeping a close eye on our people, on the people in our circle, our friends, our family, our colleagues, whomever it is, being open to talking about it. If we're the ones struggling, being able to say, oof, I'm really struggling, I'm having a hard day, a hard week, could I chat for a minute? And also that we're willing to have the hard conversations and bring it up with a friend or a colleague or a loved one and say, how are you doing? Because I think generally I would feel much better if someone's irritated at me because I asked rather than I didn't. And certainly for myself, if I'm the one struggling, maybe in that moment people may be irritated, and later that can be life-saving to know that somebody asked. And
we're out of time, but I was just going to ask you, so do you do your hair as a talking thing this month, the color of suicide awareness, to make people as a conversation piece?
No, not intentionally.
Okay.
I love color and vibrant color, so always have fun colorful hair. But I also do a psychedelic research, so it seems nice and appropriate to have fun, colorful hair.
Well, it's very bright and happy for sure.
Yes.
Thanks for sharing.
Thank you.
Thank you, Doctor.
Thank you so much.
And if you or someone you know is struggling from suicidal ideas or ideations, rather, the Suicide and Crisis Lifeline is available. That's 24/7. You can call the number here on your screen. You can call or text it. It is 988.
All right, let's talk about traffic real quick and see where those problem spots are. You can start by looking at this map.